Hello and welcome to Health Matters on Channels Television. I am Mary Alale Yusuf. As usual, let's go to the figures of COVID-19 in the nation and the world. There are now over 189 million cumulative cases of COVID-19 globally. And as at Friday, July the 16th, the death toll was over 4 million. In Nigeria, there were more than 169,000 confirmed cases of COVID-19, more than 164,000 recoveries, and 2,126 deaths. That makes a total of 764 new infections. They keep getting higher. 243 recoveries and 4 deaths recorded in the week leading up to July the 16th. Recovery rate has dipped again to 97.3%. Case fatality still hovering at 1.26%. Tested samples are over 2.3 million. The first phase of vaccination is officially over, but more vaccines are expected between the end of July and September. To the topic of the day, health communication can be described as the study and use of communication strategies to inform and influence individual and community decisions that enhance health. This is usually done by the use of models to encourage positive changes in attitudes and behavior. My guest is a health communicator, Dr. Noimat Balogun. You're welcome to the show.
Thank you for having me.
Oh, by the way, she is a doctor and a health communicator.
Thank you very much.
So, one wonders, health communication, why does it have to be, separated onto itself? Is it that important? But with COVID-19, it's beginning to look, like, yes, we really need to somehow communicate the truths of this disease to people. We've had problems with masking up, problems with physical distancing, problems with washing of hands, touching the face, all those things. People say, it's pandemic fatigue. But from the beginning, there were problems.
Yeah.
Was there something wrong with the approach?
Thank you very much for having me. I think that one of the things we need to understand is that people, you and I, everyone, isn't a laboratory animal. It is a laboratory animal that you're going to, decide that this is what I'm going to tell this particular animal to do, inject, and you have an idea of expectation. But for the human being, we have our own peculiarities. A lot of times you hear people saying, even twins born of the same mother do not act alike.
That's right.
This one would like a particular kind of food, that one would like a particular kind of food. So for that reason, because you cannot say it as a way of, you cannot confidently say this is the way this person is going to react, this person is going to behave, then the idea of COVID-19, the masking, the safety measures is one of the things I think it has been able to show is giving us much more understanding of the complexities of the human being. Human beings aren't people that you would just decide that this is the way you're going to do it, even when they are in the face of danger.
That's it.
Yes.
Or can we say that they don't really believe that there is danger?
Okay, so there are different things. So what is dangerous to me may be different from what is dangerous to you. Don't forget that we have different exposure. Someone who grew up in a community where people die daily from communicable diseases and all of that says, what is new? Someone who grew up in a community where maternal death isn't a common occurrence. When that happens, then you know that, oh, this is something new. So we are talking of people with different social determinants entirely in terms of exposure, the education, the knowledge, the practices, they are different. So our understanding and the way we view danger differs. So for some people that have had like a very rough path during the lockdown restrictions, it affected their businesses and all of that. What they see as danger is poverty.
Okay.
I mean, I'm
And
not
they
able
said
to
so.
eat.
They said so, that
So,
there's a, this is not a COVID-19 thing.
do you understand? So at the end of the day, when you're talking about COVID-19, the person is telling you, if I don't have food to eat, that COVID will still kill me. So please, let me even look for something to eat first. So for me, I think it's being able to understand the different complexities that make up human beings, the different determinants that define them. And then when we are, kind of like designing messages for them, we understand that even with the best of messages, some people will still not believe. And we realize that it is not just in Nigeria. I mean, we've seen enough evidences. We had the president of a country that didn't believe in this thing until it got too late in his country. So it's not even something that you're looking at, maybe education. Even across educational backgrounds, some people will still not believe. And I mean, that can be accounted for. Anytime that there's an innovation, some people would, be very, very curious to know about it, know what the change is all about. Some people would wait and say, let me see what is going to happen to people that have taken the COVID vaccine first. If they don't die, then I will take mine.
Okay, let's just quickly shift a little bit to, how people feel about, death and all that. In the face of the figures, I mean, the figures are being touted, local, global. Why has that not moved people to do, what is right by
because
the government standards?
There are quite a number of other factors that kind of like make or mar these figures. Political factors.
Okay.
A lot of times when people have issues with governance, when people have issues with the economy, they tend to kind of like, you see a lot of things happening on Twitter before it was, they tend to kind of like have like a referred pain. So they do not believe anything that comes from the government. And so as a result, they are not believing any figures that come. However, that is one set of people. There are other sets of people too that, so they probably thought of it. They didn't believe it until they saw a close friend having COVID.
Oh, yes.
And then because they now saw this thing, this is a real life event, then they started believing. And then there would be some people that they were probably just, at the nick of just believing it. And then you have a video that says, this is what's just been sent from a particular developed country saying, people that take this particular thing would die after 2 years. So there are a lot of concerns. There are a lot of issues. There are a lot of misinformation. So when you Google, when you check the search engine and you want to check stuff about COVID, there are a lot of information coming up. And when people are inundated with information, then sometimes it leads to confusion. When people are confused, sometimes what it leads to is denial. And so they just feel, you know what? Something is going to kill man. So let's just live our lives. And that was what you saw with the Owambe that started coming up during the December period. These are people that have waited. I know of people that had not gone out.
So they couldn't wait to let it loose.
And they just felt, we haven't gone out since. This December, it is just a time for merrymaking. Let's just do it once. And some of them did have COVID. So the idea is...
what that did? That made the figures right.
Yes, it did. It did. And by the time people were then saying, this thing is really affecting us, let's stop it. Of course, some other people had already been exposed. So for me, I feel that it just shows us that really communication for health isn't something that is going to be a reactionary method, i.e., when we see that the wave we now have a second wave, then we say, awareness. The third wave, awareness. Rather, ideally, it should be something that is like proactive. Proactive because the behaviors of man, the human nature is funny. This minute, they believe what you're saying. The next minute, something else changes.
That's because somebody comes and puts a spoon on his shoulder and tells you there's electromagnetic waves in the vaccine. Meanwhile, he has put gum there.
But the truth about it is that social media has come to stay. The earlier we understand that, the better for all of us. So right now, it means that when we're looking at interventions for health, we need to put social media and all other sources of possible misinformation into cognizance.
Okay.
It is
you've raised quite a number of issues, but I want to tackle the first one, which I feel will spoil everything. It will not let you even go further into this health communication if it is not tackled. I was getting a sense that people in poorer countries are less likely to believe because their mind is on their economy. Their mind is on sustenance. Their mind is on food. Is that the situation we are facing now?
Okay, so the truth about it is that quite a number of efforts has been put in place at the national level, state level, local level. But then the truth about it is, we're talking about over 180 million Nigerians. So it means 180 million possible different behavior and all of that. It is not easy to be able to deal with that kind of overwhelming situation. So definitely you would have things like this coming up. It would happen even for developed countries that have had communication since, they still, you still have some of them not, relatively believing. However, one other thing that we now need to start looking at is our own peculiarities. Our peculiarities that, okay, our people that may not believe this, but what will they believe? So I think one of the things we need to do is to be able to look at networks that we can leverage upon.
Okay.
What networks have worked in the past? Just the same way during the time of Ebola, you saw the government leveraging on the networks already for immunization, the polio immunization. And so it was easy for us to, for NCDC and all of them to put all those things in place to tackle, the Ebola situation. Now we have COVID. And the difference is that COVID isn't looking like, the next minute you're thinking it's going, and then the next minute something else happens.
Tell you another wave is rising.
Exactly, another wave is rising. So it means that more than ever before, we need to be able to have a design thinking that permeates the clinical form of health down to the community and is integrative. Now, like you mentioned concerning the economy, the truth about it is that an hungry man will probably be an angry man. So it means if you're going to be telling people about coming for vaccination, doing their safety measures and all of that, the other social determinants also have to be taken care of. So more than ever before, this is the time for the different sectors, economy, the community affairs, health, environments to come together to work together. There has to be an integrative way of creating intervention in the different communities. And please, when we talk about communities, I hate to hear of the fact that people just assume this community people are the informal settings that do not understand health. I was having that discussion earlier that one of the sets of people that, kind of like got a really, really bad wing of this COVID issue is the education sector and the religious sector, because these two sets of people were really affected during the lockdown restrictions.
These are people you call influencers.
Yes. Influencers.
We'll go for a break. When we come back, we'll talk about them. Let's go for a short break. When we come back, we'll talk about the influencers for positive behavior. Stay with us. Welcome back. You're watching Health Matters on Channels Television, and we're talking about health communications, especially in relation to COVID-19. Call 0805-468-3514 if you have questions on the topic to engage Dr. Noimot Balogun with. Now, let's talk about solutions. How do we fix this? Now, there are no more vaccines. We finished the first phase. In fact, according to Africa CDC, we've exhausted every shot but 2,000. I don't know where those 2,000 went to. Maybe some states are still using them. But, it's like we really made good use of the vaccines. But we don't know when another set is coming. And they've said, science has said that the infections are less when vaccination is going on because more people are covered. Now there are no vaccines. We might have to wait till the end of July or into August or September, and days are going by. Delta is in the country, it's spreading. Delta spreads faster than other things. Who are these influencers that are going to help us spread correct behavior, especially now that there are no vaccines?
I think that so far, they've started on a very good note. I remember that about some days ago, the Lagos State government and the Presidential Steering Committee had, this engagement session with the, white chiefs and a number of other influencers. For them now stepping this down, I think that we need to look at influencers across the formal to the informal sector. So I take it, let's just start from the business sector. We know that because of the effects of COVID, the work balance productivity in Nigeria has changed. So we now have some people doing the remote work. So the question is, have these people been vaccinated? So if these people aren't vaccinated, how do you get them to get vaccinated? So it means that people in the formal business workforce, we need to, kind of like have that engagement with the different companies to think of, vaccination for them, either in the office or at home.
Okay.
Now, then we take it to education. Like I mentioned earlier, quite a number of, almost all schools were locked down during the time of the restrictions. And so this means that the education sector, however...
Let me just put a pause on that. We'll continue, but let's take this call from Okorafo. Hello, Okorafo.
Good afternoon, Good afternoon, doctor.
Good afternoon. What's your question?
Doctor, I want to find out from you that how do we differentiate COVID-19 and this current one they are telling us Delta variant? And today, we don't even know where to go. Is it the same symptoms or different? And what do Nigerians do to boost their immunity? Because we are waiting for the vaccine. Up to 2% or 3% of Nigerians the vaccine. So what do we do? Because we are also looking for our own local produced virus, local vaccine we have not seen. So what do we do now?
Okay, so there you go. He's even thinking there are two different diseases.
So the truth about it is that try to specify the disease, COVID-19 has its own safety measures. I think many times
let's first establish that the Delta variant is also COVID-19.
Yes, it is also COVID-19. Of course, it has been said to be more virulent, but then the truth about it is that the safety measures are the same. Now, the question is, are people ready to follow these safety measures? We still see Nigerians going out in droves into communities, markets, into places of gathering without the mask. I remember one day going out and somebody told me, Haja, remove this mask, Koro don't go. So in that situation, the person isn't just confident enough. The person is even trying to influence me to remove the mask. So I think instead of us trying to say, oh, what exactly is this thing? What drug are we supposed to use? What local drugs can we use? The safety measures have been proven to work. The safety measures are that if you want to go out of your house into a gathering, you should be, you should be using your face mask. You should, have regular hand washing, especially when you've touched surfaces, and all of that. And the third part of it is that you should stay at a distance, a safe distance from people. Now,
the precautions have not changed. They're the same.
Now, the physical distance is one issue that Nigerians, are struggling with.
Yes.
And you realize that even when there's no need for you to have that close contact, people just believe that, oh no, I can't. I have a way of getting around this. So I think that whatever it is, we still need to take our people back. That while we wait for the vaccine, we still need to do the safety measures. The safety measures have been proven through a lot of research to work. So, yes, I understand the fact that it may not be so easy to use the mask. But the question is, if you know you are not going into a gathering, so there's no need for you to use the mask if you're going to be alone at home. But if you're going to go into a gathering, then you should. So it's for you to now think of it as this is a form of responsibility for myself. For myself
to
first,
myself and
to myself
others.
And to others.
We're getting another phone call. Hello. Abdul Rahman.
Hello.
Hello. What's your question?
I just want to say that there's nothing called COVID.
There's no... I didn't get that. Okay, I think we've lost Abdul Rahman.
Yeah.
Did he say there's nothing called COVID?
I didn't get that too. Actually. So I feel that, and going back to what I was saying before the first guy called.
Yes, you were about to talk about teachers.
The teachers. So, I belong to a particular group on social media that has close to more than 250,000 group of parents and teachers. And for every time somebody puts something on COVID, you see the way a lot of these people just go, oh, so you people want them to close schools again? You people want them to close schools? So it means that until we are able to get those people's concern, at least try and let them see that, okay, don't worry, we're not talking about, people leaving school now. Rather, we are talking of how to make you people to be influencers. And how do we make them to be influencers? Recognition. Nigerians love recognition. When people are recognized for doing something good, you give them the certificate of recognition. Let's say the local government chairman in that community recognizes that this school has been found to be compliant for COVID-19, or then let's even take it, the big way. The governor of the state calls out the school maybe once every month or every week to say, these are schools that have been compliant, these are mosques that have been compliant, these are churches that have been compliant, these are markets that have been compliant.
Now I begin to understand when people say you have to look at the culture and traditions of the people.
Exactly.
Okay.
Because I keep on telling people, how did Ashwebi become something that right now you want to go for a particular party? People are even calling you to say, is there Ashwebi? They are the ones asking. That is branding. So we need to then look at how do we brand the messages of COVID? How do we brand it into the natural lifestyle of people?
Something like Andrew, don't check out.
Yes. So the natural lifestyle of people is recognition. Call somebody, let the governor call a particular school or a particular market or a particular church or mosque and see what is going to happen the next. Because where people are like, oh, they called it. That is my friend's school. Oh, it's my school has to be called. And so you tend to see that. So we need to kind of like put the safety measures and the interventions to wind round the natural lifestyle that people love, the things that they love doing. They love this Owambe. So part of it is that while we are developing the messages, let the messages be the ones that, okay, another thing that we can do is, oh, can you take a picture of yourself doing the safety measures? And there's a particular platform, let's say a state government platform that they can show it. And then they take the best 10 pictures and they show it on social media. No money has been transferred, just your own pictures. And then you see people doing it, it becomes a big deal. Didn't you see what happened when the Director General of the World Trade Organization, when she became the DG, Dr. Okonjo-Iweala, everybody started having the gele.
That is true.
So that
but
is
on
branding.
this note, we've got to close the show. Thank you so much. And it was really getting hot.
Yes,
thank you so much for coming to the
it,
show.
really.
Thank you for being there and listening in. Thank you, Abdul Rahman and Okorafo, for your questions. You have a wonderful day. I am Mary Alale.